Chapter 6: Physical Growth of Infants and Toddlers. Infancy is often defined as the period from birth to 18 months of age, and toddlerhood is 18 months to 3 years. Many changes occur in a child's development during this period of time. In this chapter, trends in infant and toddler physical and motor development are explored, and the remarkable growth of the infant and toddler brain is examined. Cultural differences in child-rearing practices or beliefs that lead to variations in these areas are considered, as well as atypical patterns of development. Interventions to support children with challenging physical conditions are also presented. Recent research that documents the rapid growth of sensory development during this period is presented, including perceptual development related to visual, hearing, taste, smell, and touch. This chapter also has 4 critical concepts. Physical growth, critical concept number 1. Physical growth is rapid in infancy and toddlerhood. Children acquire many new motor abilities and self-care skills during this developmental period. They also acquire new perceptual abilities. They can see, hear, touch, taste, and smell as well as adults by age 6 months. Physical growth and perceptual and motor development progress in a relatively fixed order. For example, babies swipe at objects before they can grasp them. They hold objects before their fingers and palm before they can use a pincher grasp. Toddlers view objects clearly, but only later will move their eyes and head to scan them fully or solve problems with them. Critical concept number 2. There is great individual variations in the age at which perceptual and motor abilities are acquired. Culture may be one factor which influences the pace of motor development. The games parents play with their babies, carrying practices, and the kinds of toys available can affect physical competence. How quickly toddlers learn self-help skills, such as toileting, also can be influenced by cultural beliefs and practices. Critical concept number 3. The brain grows and develops at a remarkable rate in infancy. A typical 3-year-old has twice the number of synapse connections among brain cells as adults. After age 3, children lose synapses they do not use. Stimulation and warm, responsive caregiving are needed to ensure that the important brain cells connections are created and maintained. And lastly, critical concept number 4. Perceptual and motor development is affected by challenging conditions. Genetic disorders and environmental trauma before or during birth can significantly impair physical growth. Adaptations in child care programs and intervention programs that provide services to babies and toddlers and their families can offset the negative effects of these disorders.